Have you ever noticed swelling in your legs after a long day of standing or walking? Or maybe your feet feel heavy and tired, especially in the evening. What if I told you these symptoms might be more than just fatigue? Recently, former President Donald Trump was diagnosed with a condition known as chronic venous insufficiency, and it's something millions of seniors deal with every single day, often without even knowing it. In this video, we're going to break it all down clearly and gently. We'll cover what chronic venous insufficiency, CVI, actually is, what causes it and why it's more common in older adults, the early warning signs and symptoms you shouldn't ignore, how the condition was recognized in someone like Trump, and what it means, and most importantly, what you can do if you or a loved one is showing signs of CVI. Let's get into it. So, what exactly is chronic venous insufficiency? At its core, CVI is a condition where the veins in your legs stop working efficiently. Normally, veins are responsible for carrying blood back to your heart. In your legs, those veins have a tough job. They're working against gravity, especially when you're standing or walking. To help with this uphill battle, the veins in your legs have tiny one-way valves. These valves open to let blood move upward and close to keep it from flowing back down. But over time, those valves can become weakened or damaged, and when that happens, blood can pool in the lower legs. This pooling leads to swelling, pressure, discomfort, and eventually more serious symptoms if left untreated. Now, here's what's important. This isn't just a cosmetic issue. Many people think, oh, it's just some spider veins, or I'm just getting older. But CVI is a circulatory disorder, and it affects your overall vascular health. Left unmanaged, it can lead to ulcers, infections, and even blood clots. Why does this happen more often in seniors? Great question, and one we hear all the time. As we age, several things happen that increase the risk of venous insufficiency. Vein walls lose elasticity. Valves wear out or become leaky. Muscles in the legs weaken, making it harder to push blood upward. Years of standing, sitting, or weight gain can add up and damage vein function. For seniors, especially those over age 60, this becomes a progressive issue. You might not notice it at first, just a little swelling at the end of the day. But then your shoes feel tighter. You start seeing dark patches or skin changes around your ankles. Maybe your legs feel achy even when resting. This slow buildup is exactly why CVI often goes undiagnosed until it becomes harder to manage. So what does this have to do with Trump? According to publicly released medical reports, Donald Trump was diagnosed with chronic venous insufficiency as part of an overall vascular assessment. And while some media outlets glossed over it, others noted this as a significant health marker, especially in older men who are relatively sedentary or have long-standing circulation issues. The takeaway isn't political, it's practical. When a high-profile figure like Trump is diagnosed with something like CVI, it shines a light on a condition that affects over 25 million adults in the US, and many don't even know they have it. The truth is, CVI is very treatable when caught early, but it requires awareness. Knowing what symptoms to look for is the first step. Let's talk symptoms. What are the signs of chronic venous insufficiency? Some are mild. Some are easy to ignore. But over time, these signs tend to build. Here's what to watch for, especially in yourself or aging loved ones. Swelling in the lower legs and ankles, especially at the end of the day. Aching, tired, or heavy-feeling legs. Itching or tingling sensations, especially around the calf. Varicose veins, those blue or purple bulging veins under the skin. Skin discoloration, usually brown or reddish near the ankles. Restless legs or cramping at night. hardening or thickening of the skin, especially around the ankles, slow healing wounds or ulcers near the lower legs. You don't need to have all these signs. Even one or two should be enough to raise a flag and talk to your doctor about checking your leg veins. And here's something important. These symptoms don't always hurt. That's why many seniors ignore them. But just because something isn't painful doesn't mean it isn't serious. What causes the condition to worsen? There are a few habits or circumstances that can speed up the damage. Sitting or standing for long periods without movement, lack of physical activity, obesity or excess weight, smoking or previous vascular issues, poor diet high in salt, processed foods, and low in hydration. Aging itself is a factor, but lifestyle plays a huge role in how quickly CVI progresses. That's why prevention and early care matter so much. You can't reverse time, but you can absolutely reduce the pressure on your veins and support better circulation. How is chronic venous insufficiency diagnosed? Alright, now that we understand what chronic venous insufficiency is and why it matters, let's talk about how it's actually diagnosed. If you or someone you love has experienced any of the symptoms we mentioned earlier, especially swelling, heaviness, or skin discoloration in the legs, it's time to take that seriously. The first step is usually a physical exam. A doctor will check your legs for visible varicose veins, swelling, skin changes, or ulcers, but they don't stop there. To confirm CVI, the most common and effective test is a duplex ultrasound. This is a painless, non-invasive scan that uses sound waves to measure how well blood is flowing through the veins. It shows if the valves are working, where the blood might be pooling, if any blood is flowing in the wrong direction, called reflux. It's like having a camera that peeks into your legs and shows exactly where things are getting backed up. Other imaging tests might be used in complex cases like venograms or MRIs, but for most seniors, the duplex ultrasound gives a clear diagnosis. And remember, early testing means early action. You don't want to wait until the skin starts breaking down or ulcers form. What treatments are available? Once CVI is diagnosed, the good news is there are a range of treatments available, and many of them are non-invasive. Let's break it down from mild to more advanced approaches. 1. Compression therapy. This is usually the first line of treatment. Special compression stockings help improve circulation by gently squeezing the legs. This reduces swelling, supports the veins, and helps blood move upward more effectively. They come in different strengths, so it's important to get the right type from a medical provider, not just grab the first pair you see at the store. And yes, they can take a little getting used to, but for many seniors, wearing compression socks daily is a game changer. 2. Lifestyle adjustments. Simple changes can make a huge difference in how you feel. Elevate your legs for 15 to 30 minutes a few times a day. Avoid sitting or standing for long stretches. Move around every 30 to 60 minutes. Keep a healthy weight to reduce pressure on your veins. Add gentle exercise like walking, swimming, or leg lifts to boost blood flow. Reduce salt intake to decrease fluid retention. These are things anyone can do, no prescriptions required, but they work best when done consistently. 3. Medications. In some cases, your doctor might recommend medications that improve vein tone or reduce inflammation. For people with a history of clots, blood thinners may be part of the plan. But here's the thing. Medication is rarely the only answer. It works best in combination with lifestyle and mechanical support like compression. 4. Minimally invasive procedures. If symptoms are more severe or if conservative treatments don't help, There are outpatient procedures that can close or remove damaged veins. These include endovenous laser therapy, EVLT, radiofrequency ablation, RFA, sclerotherapy using a solution to collapse small veins, vein stripping or ligation in rare, more advanced cases. These procedures sound intimidating, but they're often done with local anesthesia and minimal recovery time. Most people walk in and walk out the same day. And no, getting a vein treated or removed doesn't harm your circulation. Your body reroutes blood through healthier veins. It's like clearing a blocked road so traffic can flow freely again. Can chronic venous insufficiency be cured? This is one of the most common questions seniors ask. Can CVI be cured? Or am I stuck with it forever? The honest answer is, CVI is a chronic condition, which means it's long-lasting and may not be fully reversible. But that does not mean you're powerless. With proper care, you can manage the symptoms, stop it from progressing, and in many cases, even reverse early damage. Think of it like this. You might not be able to erase it completely, but you can absolutely control it and live your life without constant discomfort or risk. And here's where attitude matters. The sooner you start caring for your veins, the better the outcome. It's never too late to make changes that protect your vascular health. Home remedies that actually work. You might be wondering, are there natural ways to ease the discomfort? Absolutely. Here are a few home-based remedies that are simple, safe, and surprisingly effective. Horse chestnut extract. This herbal remedy has been shown to improve vein tone and reduce swelling in some studies. Always check with your doctor before starting supplements. Massage and dry brushing, gentle upward strokes can stimulate circulation. Avoid if you have skin ulcers or infections. Epsom salt soaks. Soaking your legs in warm water with Epsom salt may relieve tiredness and improve circulation. Hydration. Drink plenty of water. Dehydration thickens the blood and makes circulation harder. Anti-inflammatory diet. Focus on foods rich in antioxidants like berries, leafy greens, fatty fish, and turmeric. Avoid processed sugar and excess salt, which contribute to inflammation and swelling. These are low-cost, accessible tools that anyone can use. Even small daily habits add up over time to improve your vascular health. What Trump's diagnosis teaches us about aging and circulation. When news broke that former President Donald Trump had been diagnosed with chronic venous insufficiency, it caught a lot of people off guard. It reminded us of something important. This condition doesn't discriminate. It doesn't matter if you're famous or not, wealthy or not, male or female. If you're over 60, especially if you spend a lot of time sitting or standing, CVI is a real risk. What Trump's diagnosis showed the world is that even powerful, high-profile individuals have to face the realities of aging. And when it comes to vein health, you can't ignore the early signs. It also reminded millions that chronic venous insufficiency is not rare, and it's not just about vanity or varicose veins. It's a medical condition that can affect comfort, mobility, and long-term wellness, especially in older adults. So, rather than panic, this is actually an opportunity to become more aware, to pay attention to our own health, to have real conversations about circulation, aging, and prevention before problems get worse. The connection between vein health and overall wellness in seniors. Let's go deeper. Why does chronic venous insufficiency matter so much in senior health? Well, it's not just about leg pain or swelling. Poor circulation impacts multiple systems in your body. Your heart has to work harder to pump blood back from your legs. Your brain gets less oxygen when your body isn't moving blood efficiently. your skin and tissue become more prone to breakdown, leading to ulcers. Your mobility declines because you're in discomfort or afraid to walk. And here's the real danger. When seniors stop moving because their legs hurt or feel heavy, they fall into a vicious cycle. Less movement means worse circulation. Worse circulation means more symptoms. More symptoms means less movement. That cycle leads to reduced independence, increased risk of falls, and even depression. But here's the good news. You can interrupt that cycle by recognizing CVI early and addressing it with simple tools like compression therapy, diet changes, leg elevation, and gentle activity. You can dramatically improve your quality of life. Warning signs that should never be ignored. If you take one thing from this video, let it be this. There are certain signs that should never be brushed off. If you notice any of the following, it's time to speak with a doctor. Unexplained swelling in one or both legs. Skin discoloration, especially brown or reddish patches. Leg pain that gets worse at the end of the day. Visible veins that seem to twist or bulge. Open sores or ulcers on your lower legs or ankles. A feeling of heaviness or aching after sitting or standing. These aren't just signs of getting older. They're your body's way of saying, "Hey, I need help." And the earlier you respond, the easier it is to manage. What you can do today to protect your legs. You don't have to wait for a diagnosis to start making changes. Here are 5 simple things you can do today to protect your leg health and overall circulation. 1. Get up and move every hour. Even a short walk around the room helps. 2. Elevate your legs for 15 minutes, twice a day. Let gravity work for you. 3. Drink plenty of water. Hydration helps keep your blood flowing smoothly. 4. Wear compression socks if you sit or stand for long periods. 5. Watch your salt intake. Less salt means less water retention and swelling. And most importantly, listen to your body. If something feels off, don't brush it aside. Wrapping up the video, so let's recap. Chronic venous insufficiency is common, especially in seniors over 60. It happens when the veins in your legs struggle to return blood to the heart. Early signs include swelling, leg pain, and skin changes. It's manageable with simple lifestyle changes and medical support. And yes, even former presidents aren't immune. But you have the power to take charge of your circulation, your mobility, your comfort, your independence. You deserve to live fully, without pain, heaviness, or limitations dragging you down. Gentle, encouraging sign OFF. If this video helped you or someone you love, go ahead and click that like button. It helps more people find this vital information. And if you want more tips on aging gracefully, managing chronic conditions, or boosting everyday health after 60, be sure to subscribe to Wellness and Wisdom. We're here for your journey, one step at a time. Comment below. Have you or someone close to you dealt with chronic venous insufficiency? What helped the most? Let's share wisdom in the comments. Thanks for watching, and remember, your health is your power. Never ignore what your body is trying to tell you. This is Wellness and Wisdom. See you in the next one.